Welcome, Dr. Smith. It's good to have you.
Good morning.
This this is a nice topic to talk about because you're working and really helping a lot of people with low vision issues, and it's something that I think more people would like to know about. So, but I'm interested just in getting a chance to look at your bio a little bit about your background. You're an optometrist, but you also you did some extra fellowship and residency training in low vision. Um, is, Tell me what's involved in that, and how long does that take, and what kind of drove you, or what motivated you to go in that direction?
Yeah, so I completed my optometric education at Pennsylvania College of Optometry, which is now called Salus University. And during my last year there, we had different options of rotations, and actually kind of got drawn to the area of visual impairment, low vision, and vision rehabilitation, and actually did 3 rotations outside of my externship that were heavily based in vision rehabilitation. So I worked at a private practice, also did some low vision rehabilitation with the Air Force for retired veterans in San Antonio, Texas, and then finished the training at Pennsylvania College of Optometry, and then interviewed for an additional 1-year stay at the Pennsylvania College of Optometry, specifically within the Feinblum Center, to really hone my skills on how to best serve people that have difficulty seeing, whatever that may be, whether it's reduced vision, impaired peripheral vision, issues with glare, things like that. And I guess what kind of drove me into that is I had 2 grandparents, both that were visually impaired. One from age-related macular degeneration, and actually one from hypertension. So kind of
Oh,
saw the struggles that they were going through, and actually the lack of services that were available to them, partly because they were in a rural community, and there's not a lot of residency trained low vision doctors in the United States. So I kind of wanted to make sure that I was able to help other individuals that may be having difficulty with vision.
you touched on many things I'm real interested in learning more about. I mean, obviously, macular degeneration and these conditions really affect people's vision to the point where they're functionally impaired. To where driving would be difficult, or lots of things that they want to do, reading or even watching TV. And I know that I've seen you help people in
Mhm.
ways that maybe people may not get from from everybody that they would see just for prescription or other types of vision enhancement. Um, what's the variable there? What's the difference that you bring to sort of look at things from a perspective for the really severe low vision, and how do you help people overcome some of those things related to otherwise functionally almost blind?
Yeah, I mean, I think the area that is a little bit different for us, it's kind of, which is a little bit different from other areas of ophthalmology or optometry, is it's really more like a rehabilitation session. So it's really finding out, I call it the difference between visual function and functional vision. So we're all really good at measuring what a patient can read on a chart, or assess a visual field that they're performing in the office, but a lot of times we don't really ask them how that then translates into the real world, which is what I consider functional vision. So really, how is an individual taking what they see and then utilizing it, which is very different for many people. I think a lot of it is asking the right questions, finding out what goals they want, what are they able to do, and what they aren't able to do. And then really kind of talking with the patient and oftentimes family members on, so there's a visual limitation, and then there's a functional limitation, and what can we bring together to kind of use that together. So we rely a lot on optics to kind of realize how light goes to the back of the eye to work around blind spots. So we either use telescopic glasses, microscopic glasses. Luckily, in the age of technology, we're able to really hone in on software and apps and electronic devices to help patients really kind of be able to function independently. You know, a lot of times being visually impaired is also very isolating because you mentioned driving and things like that. So, you know, patients kind of, it's not only independent living, but it's also a quality of life. So then we assess these, we evaluate kind of different tools and strategies within the office. And then luckily I have a really good team alongside of me, which consists of occupational therapists that can then introduce these devices in the home, make sure patients are successful, and really relying on community resources such as vocational rehabilitation, the Veterans Administration, Blind and Vision, the Bureau of Blindness and Visual Services, which is a state-run organization, to really kind of make sure that follow-through is happening and that patients are remaining safe and hopefully happy within, you know, within their home or within whatever environment they need to be in.
So you're really focused on not just what they can see, but also how they can function. So you're
Correct,
looking at
yeah.
how they, you know, how really you can improve their lives. And so technology is really helping a lot with this. Everything from even iPhones, right? And
Exactly. Yeah, it's not, you know, anymore. A lot of times, you know, back when I was first training, if somebody would want to read a price tag or label on the store, we would look at a traditional handheld magnifier of various strengths to kind of help that. A lot of times now patients have iPhones, which they can take a photo of it or they can use it as a magnifier. So that's a tool that they have readily accessible to them. So we can kind of use sometimes even what they have and just show them how to better use it for their needs or what they want to be able to do, which is really kind of quite remarkable. Even within, you know, I've been out of school for 20 years. So even within that time frame, you know, things have vastly changed on how we treat or help people with vision loss.
yeah, I imagine that they're going to continue to change, and you know, it's kind of evolving all the time. So it'd be exciting to work in an area like that because every once in a while,
Exactly.
yeah, yeah. So now you've done this. You said 20 years. You've been graduated. So so tell us, you know, if there was something that you really pinpointed to, whether it be a patient that you've taken care of, or you know, some things that you've been able to accomplish, you know, successfully in building the department that you're running. What would be the thing that you're really most proud of?
You know, I really think it's just the fact of being able to offer, you know, a lot of times patients are told that, you know, there's nothing left that we can do for you medically, surgically. And so, you know, oftentimes my clinic is the clinic of, you know, last options,
Right.
which can kind of, you know, it's somewhat daunting, but I think, you know, the thing that I'm most proud of is my relationship with my patients. I've had patients that have been with me in the department since I've started. I have patients that travel very far to see me. And just the fact of almost becoming a family with them, you know, the majority of ocular diseases that cause visual impairment are progressive. So it's really not a one-stop shop. The patients are followed at least yearly, if not more often with me. And so it's just kind of nice to see how, you know, somebody enters and may not have a lot of hope, and then to see them a few years later and still living in their own home independently, still able to cook for themselves. You know, that for me is what's most important. That's why I do what I do. Because, you know, at the end of the day, that's really what we're here for. And so that's really, I think, what I'm most proud of.
Wow. It's not just an evolving field, but, here with the Department of Ophthalmology at the University of Pittsburgh, we've been growing a lot. And I've been seeing a lot of emphasis on what you're doing. Tell us a little bit about the things that you hope to see here in Pittsburgh as it relates to, what we can do in low vision and how things are changing.
Yeah, I think with the department, it's been really with Dr. Sahel being our chair, is so super supportive of low vision. Not all departments are like that, and I feel very blessed to have that opportunity. That he's very passionate about helping individuals with low vision. It's not a fast moving or maybe highly profitable area of vision compared to other areas. And I think what's really nice about what our department, and especially Dr. Sal, is the really patient emphasis on helping people, really really trying to focus on just making people's lives better, which I think is hands down a really important aspect of what's going on with our department. And I also feel what's really exciting is the new technologies and research that is going on, both with vision restoration, maybe slowing down the progression, maybe not restoring the vision, but halting progression, and actually looking at new devices and new technologies, and really kind of contributing to research to help other individuals, not only in Pittsburgh, but outside of Pittsburgh, by providing good quality research and evidence-based medicine that, what we're doing is actually what actually matters. And I think as a bigger aspect of that is, if we provide the research that the rehabilitation and the tools that we're providing to patients, I think we can also change how insurances view visual impairment, so that maybe that they would provide devices for patients, that it could be a covered service. So I think there's a whole host of things that I'm excited about, whether it be just the general support of helping patients, possibly developing new things to help patients better, and then having them be provided to patients maybe by being covered by insurance, which I think is really the key.
Yeah, and it's really interesting to see how some of that is evolving already in terms of the ability to as you said, do research, but also just use the functional assessment tools for rehabilitation and everything else that you can do to just try to understand whether a device is actually working, whether a new treatment or therapy actually has made somebody's vision improve. And as I understand, that's a big part of what we're trying to build into the new Vision Institute. When we get to there in a few years, the rehabilitation is going to be a big component of that, and there'll be a big component of low vision and functional assessment. So I'm sure that's
Yeah,
exciting for you.
yeah, the new building. I mean, we're really going to be blessed with the new building and the new area that has been dedicated for vision rehabilitation. The services that we'll be able to provide to patients are going to be really absolutely stellar. There's going to be an actual functional apartment where patients can be taught how to cook by our occupational therapists, using devices, not using devices, using new technologies, looking at lighting and contrast. And, I really feel like that moving forward, it's really going to be able to provide top-notch care to our patients, and also provide the ability and the space to provide really quality research to further the area of low vision and vision rehabilitation. I'm really excited about the new building.
Yeah. Well, thank you. And again, I'm excited about what you do. I really am. As you mentioned, your family member had macular degeneration. My mother did too. And the hardest thing is helping, someone who's going through that just understand, how they can, still function the way that they want to in the world. And your help is really important for people. So thank you for everything you do.
Oh, yeah, no, I appreciate that. Yeah, I mean, I'm just blessed to be part of a department that is really supportive. I mean, I've been here a long time, and it's kind of it's a nice family, and I feel that it's nice to work with colleagues that are stellar in their own subspecialties. It's just a really nice place to be able to provide care to patients.
Mm. Well, thank you. Again, you're a very important part of the department, so it's very nice for you to have some time. I know you're busy, so thank you for spending time with us today, and
Absolutely.
look forward to spending more time with you soon.